Good evening, Honeyridge. My name is Dr. Dave Clark, and I'm the Group Chief Operating Officer of the Aurum Institute, a public health impact organization that works in South Africa and across the continent in public health matters like the one we're going to be discussing tonight. I'm going to be talking to you about COVID-19, the disease that you've obviously heard so much about in the news and that is sweeping the world as we speak. I'm going to talk through a little bit of the facts and figures and share with you some of the reasons why the authorities are taking the actions they are right now, and which are going to lead to some of the decisions the elders will share with you later. So let's take a look at COVID-19, which stands for coronavirus disease, and the 19 is the first year in which it was identified, which was in late December 2019. COVID-19 is caused by a coronavirus, and I'm sure that's what you've heard in the news, coronavirus. The particular name of this coronavirus is SARS-CoV-2, and that's the infectious agent. And the name SARS comes from the original derived coronavirus from the SARS infection, which broke out in around 2003, excepting this is the second of its kind. And the probable reservoir of this virus is the bat, and bats in China particularly. And the disease probably jumped from the bat, possibly through another animal agent, to humans at an exotic food market in Wuhan City in the Hubei province of China, where to date the largest epidemic has taken place. This virus is notably virulent, and the transmission is probably by droplets as someone coughs or sneezes. Those drops spray out and then fall down onto surfaces which other people touch, or if you touch one another, and then from there the disease spreads from human to human. There is a possibility that some of the transmission is by airborne spray or aerosolization, but most of it is by droplets falling onto different surfaces or onto other people. And typically, COVID-19 starts out and is the cause of the common cold, a flu-like symptom in most cases, and in fact, most patients will experience not much more than a common cold. I will be going into some of the other symptoms just now, but in a limited number of patients, around about 14 to 16%, the disease progresses to a more severe form, and in some cases to severe acute respiratory syndrome, or SARS, with potentially deadly sequelae, especially amongst the elderly and those with other underlying diseases such as hypertension, diabetes, and lung diseases. So smokers and people with chronic obstructive airways diseases are more likely to develop these more serious versions of COVID-19. As you know, this is a rapidly developing global pandemic that's not yet fully understood in many ways, and I'm going to show you just how rapidly this pandemic is spreading. Right now, because we are dealing with a developing pandemic, it's a little early to talk about the death rate, but what we do know, the case fatality rate, which is the number of people who die as a percentage of those who are actually known to be infected, is estimated to be anywhere between 2.5% and 4%. But as you'll see shortly, this is strongly age differentiated. And the picture that you can see here on the right of my slides is of an electron microscope picture of this SARS virus. And these little spikes that stick up give it its name, the coronavirus or crown virus. So here's a map taken at 2300 hours on the 17th of March from Johns Hopkins University, which shows you where the virus is right now and how many cases there are confirmed across the globe, the total number of deaths, and the total number of people that have recovered. Now you'll see that that over there is China, where the disease broke out in the first instance. And then you can see how this is spreading right across the globe, initially into the northern hemisphere, but there is no country almost now that's not touched in some way or another across the globe. So 196,000 cases have been confirmed as of 11 o'clock on the 17th of March. Now, I presented to the elders on this presentation on the 16th of March, and at that point, the number of cases confirmed was just shy of 180,000. So you can see how many cases have advanced just in 24 hours. The total number of deaths is around 7,800, and the two biggest areas or countries most affected by this is obviously China in the first instance, and then regrettably Italy in the middle of Europe. But this epidemic is still developing in the United States and elsewhere in Europe, and we have yet to see what happens in the Southern Hemisphere. Just as we stand right now, South Africa has a confirmed number of cases of 62 patients, no deaths, and those 62 patients are all active right now. You can also see at the bottom of this slide, I've given you some references to worthwhile and valid sites that you can do further research or get better information. In this day and age, so much is spreading on the internet that is a lot of rubbish, myths, hysteria, hype. If you want to go to somewhere that you're going to get particularly good information, I recommend either of these two. And the South African site that has just been established by the government today, and it's a very good site, is this one over here, sacoronavirus.co.za, and I would recommend that to you. You can get a sense from these two graphs over here just how quickly this epidemic is spreading. As of the 13th of March, you can see here in the yellow lines the Chinese epidemic. So from around the late part of December, it rapidly accelerated. Over there, they changed the definition of what is an infected case. And now you can see the epidemic tailing off in China. In fact, it's almost dying out there now, with around 80,000 patients infected over the course of the epidemic. But as of the 13th of March, also there's the number of patients that are recovering, and the rest of the world's cases just starting to pick up now here late February into early March. Only 3 days later, if you look at the right-hand side over here, there's the same Chinese epidemic, the number of people recovered, which is mainly the Chinese, but you can see over here how rapidly, in just as a matter of 3 days, how the rest of the world is now starting to exceed the Chinese epidemic. And if you want to get further information, as I said, there's some good references at the bottom. This one is particularly nice. OurWorldInData.org coronavirus is very useful. I'm now going to discuss some of the particular information that is relating to this thing, which is going to be relevant to you as you consider the next coming weeks. So firstly, what are the symptoms of coronavirus disease? If you look at the top left-hand box over here, you'll see that the main symptoms are fever, a dry cough, fatigue, and to measure sputum production. That's deep phlegm from within the chest. Now, fever is very common in coronavirus disease, and most patients will get some form of fever, nearly 90%, and most patients will get a dry cough. And a lot of patients complain of severe fatigue. What is particularly interesting and what you don't see on this picture is a runny nose. Now that's quite interesting because in the common cold, runny nose is quite common. And you don't see commonly in coronavirus disease this runny nose. Now that's not to say that if you have fever, dry cough, fatigue, and a runny nose that you haven't got COVID. It can still be there, but it's not as common. If you take a look further down over here, and this is particularly relevant to us and our members at Honeyridge, you'll see that the death rates or the case fertility rates from the Chinese data strongly is influenced by age. You can see that as you start to go from 50 years upwards, especially into 60, 70, and very strongly in the 80s, the death rate or case fertility rate from coronavirus infection, COVID-19, rapidly accelerates. So the people most at risk of getting severe disease and dying from COVID-19 are the elderly, 70 to 80 years and upwards. Interestingly enough, you can see the younger people, much lower complication rates and risk of dying, And in fact, below 9 years old, it would appear that there are almost no cases anywhere. And this is different to ordinary flu, where it normally affects the young and the old. Here we actually have a virus which seems to be sparing the young and very severe on the old. Now we jump across to the right-hand side over here, and you can see the severity of the different cases. Now, in the case of coronavirus 19 infection, about 81% of cases will be mild. These will be patients who have this flu-like illness, of a cough, a fever, fatigue, but generally speaking will be mild, and they'll get better over a course of about 2 weeks. However, these are the patients that generally walk around and spread the virus further. So these patients here are as important as those above. 14% will be severe and may need various forms of hospitalization and support, and indeed about 5% of cases will become critical. These patients are so badly ill that they're going to need some form of respiratory support, ventilators, hospitalization, and in fact may die. So as it presently stands in China, around 2.3% of all cases died in the Chinese experience. So around 81% mild cases, 14% severe, 5% critical, and there is a group at the bottom that are never ever diagnosed, either because they're not tested or they didn't feel sick enough to present. So there's some very interesting facts about COVID-19, and you can see how this may affect you and your family, especially amongst the elderly. So what about things at Honeyridge? What are the risks that we face? Firstly, I think the most important thing here is panic. As you can hear from the media, as you can experience in your WhatsApp groups, as you read various tweets, depending on which form of social media you're subscribed to, you can see that there's a general sense of panic around the world. Borne out by crazy things, people buying up toilet paper and hand sanitizers and food. I saw a picture today of several stores where people have bought up all the food in the expectation that there's going to be some kind of shortage. Another severe risk that we face is the general spread of misinformation, and this is a serious issue. This misinformation can take the form of people who spread messages about fake cures. I've seen quite a lot. You can drink water that will wash the virus away, or you can use garlic that will keep the virus at bay. It almost sounds like we harken back to a previous era. That various over-the-counter medicines might do this for you, that you should avoid people altogether. There's all sorts of misinformation that is out there. Please, can I appeal to you all to take great care of what you read and what you share with others. It's very quick to pass on a WhatsApp message to your entire group, and often the information is not true. Just this very week on Classic FM, I heard a particular announcement from Classic FM that there's a hotline for people who are worried about having COVID-19. They should phone the hotline and stay put. Don't go and seek help because somebody will come to you. Well, that was complete rubbish and misinformation. It's not true. The next risk is actual infection. And there are some serious health sequelae for our congregation members wherever they are. Now, that doesn't mean just because they come to church. And this is particularly true of the elderly, as I shared with you in the previous slide. Of course, there's also the risk of actual infections and serious health sequelae by coming to church. Once again, especially amongst the elderly. Because it's where people congregate if they haven't followed good public health hygiene practice, that they may well spread the virus from person to person. And then there are those who come to church even though they are sick, when they shouldn't be coming. Another risk is misdiagnosed cases. People who actually aren't sick, and they are very worried that they might be. And we are seeing strange behaviors, as I've said, people hoarding things, hoarding sanitizers, hoarding toilet paper. Another risk is that we might abandon one another, or abandon the elderly, or abandon other people who are sick in our own self-interest. Obviously, we're going to be faced with sick members with other diseases, and they're not COVID-19, but we are too scared to go and seek them out because we're worried about this disease. And there's also the risk of everybody rushing to the nearest hospital or GP practice to try and see if they can get tested because they're worried about something, and we swamp the system's ability to diagnose. I'll leave it to the elders to talk about the spiritual consequences of fear. And then, of course, there is also the risk that we redirect our resources away from helping members of the church, away from helping the poor and those who need us, because we're in such great fear ourselves. I'm now going to talk very briefly about how this public health response works. Why has the government suggested that we close down groups of more than 100, that we take all sorts of drastic actions? I'm going to do that by means of a simulation, which I'm going to show you what the difference is between people being in a free-for-all state, where we try and quarantine them, where we distance, or what's called social distancing, and how we can do that and what difference it makes. So give me a moment while I switch slides over here. And you can see that I'm going to be working through very rapidly a simulation which explains why it's so important to flatten the epidemiological curve of this coronavirus. So the thing we're very worried about in coronavirus type infections is this rapid rise of the number of cases that you can see on the bottom of the screen over here. That rapid rise in cases, if not checked, rapidly overwhelms the health system's abilities to manage the patients. And that's what we've seen in Italy. The epidemic arrived in Italy and rapidly overwhelmed Italy's ability to manage all the cases, and hence they've got the highest number of deaths outside of China in much quicker time, as they are unable to just deal with the sheer load of patients coming through. So that's the so-called exponential curve, and that's what worries us. Now you can see at the bottom of the screen how this virus spreads. It goes from person to person, and once a person is infected, the virus comes back through that community and it doesn't infect you again. It then starts to bounce around. But it doesn't take very long for people to get infected if they're just 5. Now I'm going to show you a simulation where we start out with a random number of around 200 people in a community, and one person gets infected, and you can see that if we freely move around, the patients will get sick quite rapidly. But before we do that, just please take notice that you get infected with this disease and later on become well again and then immune to the disease after that. So you don't get infected twice. But let's see what happens when this disease, and it's a corona type disease, this is just a simulation, in a town of 200 people will get sick. We'll start with somebody at random in this community, and you'll see when there's no restriction on movement, no restriction on how people behave, no testing, no treatment, what happens? Now let's have a quick look. You can see there we start out the simulation, how quickly this disease spreads throughout the community. And you can see in the little developing graph at the top over there how the cases rapidly rise throughout the community before they start to become well again, and the pink little dots start to, those are people who are not infected anymore, or who are now recovered. You can see how rapidly that rises and how long it takes before people start to get better. It's that rapid rise there that overwhelms the ability of the health services to deal with it, and that's what leads to major mortality or death. So this is a simulation where we have freedom of movement amongst the entire population. The next simulation, which is very interesting, shows what happens when you try and quarantine a portion over here of the community. And you can see initially that this part of the community over here is kept free, but eventually these quarantines break down. At some point in the whole process, people actually start to break down the barriers, and you can see how we then get spread from the originally quarantined community into the rest. So now you can have a good look there and see how initially a quarantined group spreads to the other part there, and you typically get 2 curves of epidemic, one there, and you'll see later on a second epidemic there. before everybody starts to recover. And once again, that overwhelms the health services. What we're now going to have a look at very briefly in a simulation is where you actually restrict the movement of people. So in this next simulation, you're going to see what happens when 3/4 of the population doesn't move around and the remaining quarter does move around. And you're going to get to see what difference that makes. This is so-called social distancing. So let's have a look over here. There's the one person. And now you can see a lot of the people aren't moving around, and there's still some who are. And how much slower now the development of this epidemic is. You can see in the blue section over there how many people are still well. The brown is those that are infected. And now we're starting to see at the top the people coming through that are starting to recover. You can see how much slower the development of the epidemic is, and this gives the health services more time to deal with those who are critically ill. And this is a 3/4 social distancing strategy. And the last one is where the social distancing is much more intense. So now we're going to get only 1 in every 8 people being allowed to move. And now take notice of how slowly the epidemic spreads throughout the population. And this is really what we are trying to achieve throughout the epidemic in South Africa. We're trying to see if we can stop this from becoming an overwhelming thing like it was in Italy. By restricting movement, by restricting the number of people gathering in groups, and giving more time for recovery throughout the community, you can see what a vast difference this makes. And this is the point of the epidemiological effort that is being put into place by the South African authorities, assisted by organizations like Aurum. So lastly, if we just have a look then at the difference between all of those different simulations, you can see when it was a free-for-all, there was this rapid rise, overwhelming the population before there was recovery. In the second area where we quarantined people, there were 2 peaks of epidemic. In the third one, it was more smooth, and the last one, a much more flattened curve with the extensive social distancing. I've also put links to this simulation onto the presentation. You can go and look at it at your leisure. It runs differently every time you run it. So let's go back to the actual presentation itself. What are the member responses that are going to be responsible and logical in such a time as this, a time of great uncertainty and difficulty? Well, firstly, there are legal declarations. A state of emergency has been declared by the state president, and these are very valid legal things that are needed in order to enable the government to take the drastic actions that it has to do. And we do need to align with these government directives. They are not optional extras. The elders are not in a position to say we will or we won't do what we're told. Apart from it being legal, however, it is, as you've just seen from that simulation, the most rational thing to do. To stop people congregation in large groups, to close down the schools where people can infect one another very rapidly, and we do need to take careful cognizance of this as we target Honeyridge and what we're going to do about it as well. The other thing we can do is make sure that we communicate good, proper, accurate, factual information to our fellow members, to our congregants, to our families through the varying media that we use. We need to work on health facts and then deal with appropriate actions. There is something we can do about preventing this, and some of them are well known to you already. We are pursuing infection control. Just out of interest, depending on which medical scheme you're in, you may wish to have a look and see what your medical scheme will cover if you are on a medical scheme. And the Discovery Group, for example, will be paying for COVID-19 infections. So what about infection control? Well, firstly, hand washing is absolutely important. By washing your hands regularly throughout the day, especially after you've been in contact with different surfaces or with people, for 20 seconds with soap and water, you can make a big difference to infection control. Secondarily, we've been talking about social distancing. Don't go and visit in large groups if you don't have to. That's one of the things the elders are going to be considering over the next couple of weeks. Stay at home, especially if you're sick. Don't go into the community if you're not well. It's one of the strangest things that people will come with their colds to a meeting or to a group and say, well, I'm really feeling lousy today. Stay at home. Stay at home with the disease until you're better. And then to mask or not mask is really important. And you'll probably see people going around the shopping centres with masks that don't look unlike this one over here. And perhaps I'm wearing this kind of a mask. Well, here's the wisdom. A mask will not make any difference if you are not sick. So if you are not sick, it's not necessary to go to the expense of buying these kind of masks, especially these, which are probably anywhere upwards of 100 to 150 Rand. It doesn't help. These help healthcare workers prevent them getting sick, and it is useful for people who are sick to prevent them from spreading it further on. So masks are good for the people who are sick. But if you are going to get a mask, you need this kind of mask, the so-called N95 mask, and it's quite uncomfortable to wear. And possibly if you do wear it, you need to know how to do it. And if you do wear it, you're going to fiddle with it. And when you do fiddle with these things, of course, you're touching your face, and there is a risk that you even make the contamination worse. As for these kind of masks, you're just wasting your money. So in general, masks are not indicated amongst the public. They're useful for healthcare workers, and they may well be given to those who are already sick during the period that they're sick to prevent them from spreading it further. So please don't waste your money on a lot of masks. It's not going to be useful. Let me remind you, we are entering the influenza season, winter. So if you are in a program that you can get an influenza vaccination, please go and do so. They will still be very useful later on, especially if you are one of the older people or you have other health risks. So they're the things that we can in fact do. We can respond by listening to what the public health authorities are saying. We can target our communication to one another with facts, and I've given you some of the links to those facts. Make sure you're practicing good infection control, hand washing, not touching your face, not sneezing into the open air, sneeze into your sleeve on the left-hand side or the right-hand side, whichever you like. And don't bother with buying expensive masks. If you do need a mask, it's something your healthcare practitioner will advise you on. If you are able to get hold of an influenza vaccine in the next couple of weeks, it will probably be very useful to you. There is a very good site, as I mentioned a little earlier, sacoronavirus.coza. It's the government's newly established site to give you facts on what's going on. It will tell you about not panicking. It will tell you about the symptoms I mentioned a little earlier, and it will give you preventative tips. Further down in the site, you'll be able to see what is myth and what is true, how many cases there are in the country at any one time. And then there's two other useful information areas there. There is a hotline. If you need to phone it, it's a toll-free number. And if you go to this WhatsApp number and add this number to your directory, and then just ping them a message saying hello or hi, it will start to send you messaging around coronavirus as the weeks ahead unfold. So thank you very, very much for listening to this presentation. I'd like to leave you with one last thought. If you have a look at this picture of the shelves, you can see the madness that is taking place, not just in America, but here as well. This is where all the hand sanitizer was, folks. Everybody's bought out the hand sanitizer, and if you go to Clicks or Dischem right now, you'll find it very difficult to find hand sanitizer. However, just to the left and above and on the right, there is plenty of soap. You do not need hand sanitizer to wash your hands. Water and soap does just as well. It's a lot cheaper, especially now that everybody's bought up the other stocks. And it works really, really well. So folks, there's plenty of soap. Please wash your hands. You do not need to go out there and try and find expensive masks and expensive sanitizers. Soap and water will do the job. So thank you so much for listening. I hope that you will be blessed as the elders make their consideration. And let's just remember that The same Jesus that commanded the wind and the waves when he was here on earth is completely and utterly in charge of this viral infection, this epidemic as it spreads, and it will all ultimately be to his praise and his glory. Let us honor him at the end of the day. Thank you so much indeed. Good night.